Welcome to the Dr. Coffee Podcast, Motherhood and Medicine series, where we are sitting down with mothers who are medical doctors or medical specialists or have a career in medicine and are successfully navigating what it means to be a mom and a doctor. Today in studio, I'm joined by our social media queen, Dr. Pambukeli, as well as Dr. Boitumelo, our specialist guest, talking about what it's like to be a mom. Dr. Boitumelo, welcome. Good to have you here.
Thank you so much for having me, Simon. I'm excited.
And of course, Knox, good to have you with us as well.
Thank you so much for having me. I'm even more excited.
Thank you for managing to make it out of Limpopo to join us for the podcast recording. So let's start off with the very basic question, Dr. Boitumelo. Tell us a little bit about your family dynamic, your motherhood journey. Tell us about your family and your role in it.
All right. So I am a young mom. My first pregnancy was second year of internship. So yeah, that was around about 2018 going into 2019. And I've got two boys, the ages of 4 and 2. I'm married, so I've got 3 sons actually. But I mean, I'm enjoying this motherhood. I mean, now the older I get, the more I realize that priorities change. Because in internship, I was scared to tell my consultants that, I'm pregnant. I felt like I'm a little girl. But I was married then, and I always thought about how is this going to affect the roster? How is this going to affect my colleagues? But now the older I get, I'm just like, these are my priorities and this is my calling.
Yeah, that's a very, very valuable take. And I want to explore that a little bit if we may. So first of all, you did mention that you were a second year intern, but you were married, right? So you had a life outside of medicine. Mm-hmm. Had you made a conscious decision to get pregnant during internship? And the reason I asked that question is that many of our guests so far have said that they decided to fall pregnant or they were pregnant in reg time. So they were already a little bit older. They were obviously married. But for some, it was like, okay, I'm now secure. I've got a 4-year job. Now's the time to have a child. But with internship, you don't know where you're going to be next year. Mm-hmm. So was that a conscious decision where you said, right, we're married, the next logical step is to have a kid, let's just do it anyway? Or was it thought through? What was the thought process like?
So we thought about it. We discussed with my husband that at least a year and 6 months after getting married, because we just want to enjoy each other, because children come with their own things. But we planned it, and I said, okay, if we are going to fall pregnant second year internship, that means I deliver in ComServe, and in ComServe you don't have to pay back the 4 months of maternity leave. So I planned it through. And I had a bursary from Free State, and they were quite strict. They wanted me to go back to some remote village that didn't have water in the Free State. So I said to them, listen, I'm pregnant. My gynae is based in Johannesburg. We've got property in Johannesburg, so I cannot go to the Free State. I mean, it was back and forth, until they released me from Free State and the obligations that I had to carry out. And it was just perfect timing. So it took a month. I started my community service much later, 4 weeks later, than the people that I had completed internship with because of this up and down with the department and the province. So I started in Feb, and I started in February, and I was going on maternity in March. And then, yeah, I know.
Surprise.
There
goes your roster.
But I think because I came in late anyway, there wasn't much change to the roster. And then, I left. I was gone for 4 months. After 4 months, I came back and I did ComServe for another 5 months, I think. Yeah, but I'm a hard worker, so it wasn't like I was taking a back seat and whatever. I was pushing hard during ComServe, but still felt a bit guilty, There's the mom guilt. You are leaving this young child at home, and then there's the guilt that you were not here for 4 months, But that's things that people don't talk about,
Yeah. Knox, you're currently finishing up your community service. Yeah. Do you have any thoughts about motherhood and pregnancy with regards to community service, and any questions for Dr. Boitumelo around that?
Yeah, I just wanted to just firstly a comment about ComServe. I think for a lot of us young ladies who are either in internship or ComServe, there's a lot of fear that comes with wanting to start a family because of these dynamics that you actually experience. We don't know where we're going in ComServe. I didn't expect to do my ComServe in Limpopo. Now I'm thinking if I got pregnant, excuse me, you know what I mean? And now you're saying you had to go back and forth with the department. So already just hearing that, I know a lot of ladies will have a lot of reservations as to when is the right time for me to actually get pregnant. Then I wanted to ask you, having that time off, your maternity leave, how did you feel coming back now after that in terms of your competency? Because you don't have to catch up the time. So did you feel you were ready for your MO-ship after that? How was those feelings?
So I worked at a small level 1 hospital, South Rand Hospital, and I'm not going to say much about how that hospital was run, but basically you can get to work and you are meant to be stationed in casualty, but they'll say, gynae needs assistance, so please go and assist the gynae MO. And I always loved primary health care. I loved outpatients department. No one wanted to do the HIV clinic in my ComServe, so I said, bread and butter, I love it, station me there. So I think my colleagues didn't really mind because they wanted to, it's a small hospital and they wanted to do the casualties, the internal medicine and whatnot. And I said, I love HIV. I know this is the direction I want to take in the future. So I focused my energy into that. I did the HIV courses during the months when I came back. So I wouldn't say that I felt incompetent. I think I was up for it and I worked hard. I
think you spotted a gap that also worked with the fact that you were a mom.
Yes.
You know, you had left your baby at home and you were saying, okay, well, if no one's going to pick this up, I'll very gladly pick it up because it gives you that predictability. It gives you that routine that you now say, okay, well, I know what my hours are going to be like. I can plan around it because you now, not just your own schedule and your husband's schedule, but there's a little one schedule around. And how did you navigate like feeding times and nap times? As a ComServe doctor, I imagine that you would have loved to have been there for every feed, but did you delegate some of that responsibility out? How did it work?
So going back to work, doing calls was very compulsory. Like they didn't compromise on that. And being a small hospital, there weren't really doctors' quarters. So I'd have to sleep in the car. But I had thought, okay, I'm going to breastfeed until my baby is 2. This is what I want to do. But the moment I went back to work, there was just no time to express. There was no room with a plug that I could sit in and feel comfortable to express in. So I had to let go of that dream. And in as much as it was sad for me not to continue breastfeeding, but I think it helped in terms of the home dynamics because then my nanny, my mother-in-law also used to come in to help, and my husband could actually continue with the feeds. So we got into a new routine, and there were ups and downs to actually stopping breastfeeding.
Yeah. Do you think that prepared you to do your second pregnancy or pregnancy with your second child differently because you're now in a different season, a different headspace? Had you made life choices based on now deciding, okay, I've learned from the first child, that was the tester child, now I'm going to do it my way?
Yeah. So the second pregnancy, everything was fine until 5 months. So after ComServe, I was unemployed for about 4 months. Just before COVID, and I actually don't know why, because I had applied to the clinics, Hillbrow clinics, but they took like 3 months to respond until the head of department at Pulosong Hospital Casualty said internal medicine is looking for an MO. Are you interested? I said it's a bit far. It's like an hour drive, but let me just do it. So I went, and calls were compulsory there, but the department is run completely amazingly. You know, the head of department is amazing. So then I decided, okay, with my husband, I think it's time for the second born. Fell pregnant a year into working as the medical officer in internal medicine, and that was in COVID, right? So COVID, there were a lot of memorandums going out, and the most important one for the pregnant woman was that you can actually take your maternity leave from the moment you feel that you are not safe. It wasn't clear, I know. It wasn't clear, it wasn't direct. So I was like, okay, my head of department said, listen, we'll station you at MOPD, the medical outpatient department, so that you are not in the wards and being exposed to this virus.
And that was, of course, a territory you were very familiar with from having done the HIV clinic.
Yes, yeah. I was like, Lord, you hear my prayers. So that's where I was stationed. And with the calls, they made sure that they got someone on board, because there was a call where I was supposed to do 24 hours. And I started feeling this right iliac fossa pain on call. I was around 20 weeks then, and I said to the gynae MO, please just do a SONA. I just want to see what's happening. I'm hoping it's not acute appendicitis, but let's just see, because it was unbearable. And then he said, I can't really see clearly with this ultrasound. Imagine the kind of, you know, and he said, just go to your own gynae. And I said, all right, let me just call her to tell her what's happening. And I called her, I called my head of department and I said, Doc, I think we need to get someone to come and step in for me. I can't even walk. I need to go. So he said to me, okay, fine, you can go. Went to my gynae, had to be admitted same day. There was a cyst around my tube on the right. It was around 6 by 7 centimeters. And yeah, she said, listen, if we don't remove this cyst, we don't know if it's going to grow, if it's going to twist, and the baby is still growing, right? So rather we go into theater. It has to be under GA, but laparoscopically. And I was like, wow. You know, sometimes you try planning, because this pregnancy was planned. In internal medicine, I am comfortable where I am, and now this has to happen. So going back to your question, I think I was more mature then, and I prioritized my health. Because even if my HOD had said, no, please try and push maybe until 12 hours, I was going to say, no, sir, I'm out. Yeah.
Yeah, I think that's very important, is to have, like you said, the maturity and the confidence to say, excuse me, I'm a pregnant person. I actually have somebody's responsibility to somebody other than myself, and they can't speak for themselves right now. I cannot do this injustice to them. And for the rest of us listening, you know, to recognize that as junior doctors, as medical professionals, to say, guys, pregnant women are a special population that deserves special protection. Nox, you want to come in with a question as well?
I do. So I want to just interject something. You mentioned that there was a nanny involved in all of this. And I think one of the reservations I know I would have when it comes to pregnancy is knowing the demands that my work has. Who's going to support me? Who's going to help me with my children? So what was your process in finding and selecting your nanny?
So, okay, let me tell you about my home dynamics. So my husband is an ENT surgeon, right? And sometimes he does get called out in the middle of the night. And I was like, I am doing calls as well. So we definitely need someone that will stay in the house. I've never been someone that puts their comfort or, you know, doesn't want other people in their space, because I understand that you have to do what works for you, in as much as you'd want to walk around your house naked with your husband, but sometimes things don't work out that way. You know, you have to get a nanny involved, especially because we were doing calls, you know. So initially, we had said, okay, someone that is good with babies. I said, I don't mind. My house doesn't have to be clean, you know, but as long as you are good with the child, then I am good to go. And then I just made sure that I also get someone to assist her, because a small baby is quite demanding. Yes, they don't move a lot, but you have to hand wash the clothes. You know, my son had very sensitive skin. You have to hand wash. You can't just use any type of soap on his body. So I was strict about that. I got someone to assist her with laundry and ironing. I mean, that was a financial sacrifice that I was willing to make my life a bit better. I know some people are like, no, nanny's in your house, your children. But yeah, that was my rule at home, that I will always need assistance.
And how did you find your nannies? Was it online or through, word of mouth?
So I found my nanny through my sister-in-law. So my sister-in-law's nanny actually recommended this lady, because I tried the agency, but I got this lady who came in with her own beliefs, her own spiritual beliefs. She was asking, did I already pierce my child on the head because they have a red mark? Did I do a ritual? And I was like, no. Not in this house, ma'am. Yeah, so this other lady that came in, we had the same beliefs, Christian beliefs, and hardworking, young, fresh, willing to learn as well. Because I find that sometimes the older nannies feel like they're your mom, and they want to dictate everything you do. And you are also so scared to direct or reprimand them. So, yeah, that's how...
Thank you. That was so helpful.
That leads to another question. I want this to kind of be where we lead to landing on the interview. But you mentioned, older nannies sometimes treat you like you're a child, and in medicine we do put things off a little bit later in life. So, for example, you just finished internship, you do ComServe, and you're 27. At 27, some people are married with kids, and a lot of ComServers are still single, or maybe they're in committed relationships, but it's certainly very rare to have children in ComServe. So do you think that some of the registrars, some of the seniors were like, oh, aren't you a bit young to have children? Did anyone raise it and be like, well, you should have put this off till later?
Yeah, definitely, Simon. And I mean, in medicine, there's this, I don't know if you call it classism in medicine, where if you say, no, I just want to be a GP, focus on HIV and TB management, and they're like, just the GP? So you're not going to specialize?
Not just the HIV.
So I got that a lot. But I think once you know what you want to do and you are confident in it, there's nothing that should stop you. I had a lot of comments. My registrars, even in internship, they would make comments like, that tummy looks small. Don't you think maybe the baby's not growing well?
Oh,
but
wow.
I know it sounds a bit insensitive.
Just
now
to
that I
add
say it
more
again.
pressure.
Yes, but you just do what you have to do.
I think medicine people are always just in that role. Like, it doesn't even matter. It's like always restriction. Is it what's happening? And you're just like, I'm a person.
I think also we get so used to being in people's space that sometimes we lose social niceties.
True.
So we forget to have our manners around each other because we're just busy joking about, this DRE was this, and this looked like this. Oh, did you see that one?
Yeah.
And we forget, hey, around each other, it's a different level of professionalism and conduct. It's been wonderful to have you on the interview so far and on the podcast. But I want to give you an opportunity that anything that you feel junior doctors and medical students really need to know about motherhood, something that's going to be like a lasting thought to sign off with. What do you have to encourage us with?
So to all the junior doctors, I would just say, stay in your lane, dig deep into what it is that you want to do. There is still, time to change if you want to go into the non-clinical side of medicine or if you want to do something else. But just know what you want to do and stick to it. Don't feel pressurized by anyone. And if you feel like you want to wait until you finish with registrarship to have your children, go for it. If you want to have your children earlier, just make sure it's in a committed relationship, please. Then go for it, but no one can tell you how to run it. And use the support that you have. I will never stop emphasizing it. If it means having your in-laws come and visit, or having 2 or 3 nannies, do what works for you and don't feel bad about it.
Dr. Boitumelo, Dr. Knox, it's been awesome to share some time with you in the studio. Thank you for appearing on this episode of the Dr. Coffee Podcast.